I'm Gina. Welcome to Ageless Island, your destination for staying strong, sharp, and ageless inside and out. Today, we're lucky to be joined by my friend Kat. We met about 2 years ago at one of our songwriter shows in Isla Mujeres, Mexico. And then she came back again this year, and we've just been talking a lot about different health issues and some of these longevity topics and hormones. And it was really interesting because when I released my hormone episode that we'll show in the show notes down below, she texted me and she said, "Hey, I've got a really great idea." She said, "Have you thought about doing an episode on urinary stress incontinence and pelvic floor physical therapy?" And I said, "No, but that sounds really interesting." So I gave her a call and we talked it over, and I thought it sounded like a great episode. So today she's joining us and she's going to share her story. You know, this is a really important issue. I did some research, and it affects about 30% of women. They're postmenopausal. A lot of women after they have childbirth. Those are the women that report it. It's an issue that women are nervous to talk about or embarrassed to talk about. So we're hoping to get the word out, get more people having these discussions so they can understand it more and not be afraid to go out and get some treatment. So Kat, can you tell us about when your journey started and when you started having experiences with incontinence?
Absolutely. My name is Kat, like you've said, and I live in St. Pete. I've moved around quite a bit. My first experience with stress incontinence was actually in my late 20s. I had 2 kids, and I was having some issues, which I'll explain in a little bit. And then after that, I moved again. And then again, and it took 3 different gynecologists to finally get some help for the stress incontinence that I was having. I am 57 years old. Like I said, my first experience with stress incontinence was in my late 20s, so I've been suffering with it for quite a while, and I didn't get relief until just recently, and recently I mean last year. So 56 years old, that's a lot of years to have to deal with something that's extremely embarrassing, very uncomfortable, and extremely inconvenient. Because there were times where I would get dressed to go out, have a sneeze on the way down the dock, because I live on my boat, as you see here in St. Pete, and I would sneeze, leak a little urine, and have to turn around and go back to the boat to change clothes to be able to go out again. So it's an inconvenient problem to have, especially when you're an active person. So I'm very, very thankful for my persistence in finding help and seeking out what needed to be done. So.
And why do you feel like you waited so long to get treatment or find a solution?
It was a trial and error. I went to my first doctor when I lived in Mississippi, 27, 28 years old. And I embarrassingly, in tears, told my doctor, "I am urinating when I orgasm, and it's embarrassing, and I don't know what's wrong." And of course, he did the exam and everything, and he told me that my muscles were weak from having the 2 babies, and that I needed to do Kegel exercises. And of course, in my 20s, what's Kegel? He explained it. This was back in the early 90s. He said, what I want you to do. And, I'm sitting there crying because I'm young and embarrassed to even bring this topic up. And he says, it's very common. Don't be embarrassed by it. He said, but what I want you to do, and he's trying to make lighthearted of it. He said, what I want you to do is what I call Kegel exercises. And every time you're at a red light, I want you to squeeze your bottom, just squeeze, squeeze, squeeze the whole time the light is red. And as soon as it turns green, you can relax and go on about your day. The next red light you come up to, squeeze, 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 and go on about your day. And I'm like, okay. And he's like, but there's one other thing I want you to do. He said, when you're sitting there at that red light and you're squeezing and holding, I want you to look at the car next to you. And if the girl next to you has a smile on her face, she's doing it too. And it was his way of making light of the conversation, as well as letting me know that it's common. It's not some taboo thing that only a few women experience. It's common. And he was trying to make that point to me, which he did. And I appreciated it. And I went on my way and I tried the Kegel exercises, but over the years, it didn't really help any. I found out later I was probably doing them incorrectly. So And we'll talk about that in a little bit.
So what are some other things that you heard about or that you looked into that you thought might be useful when the Kegels aren't really helping?
Okay, so the symptoms got worse. It wasn't just urination during intercourse or orgasms. Now I would go, I don't know, dancing with my friends, and I would leak. I would go jogging and I would leak. I would try to go exercise and do jumping jacks and I would leak. And so then it got to be more common. And I had now moved from Mississippi to Texas, and talked to my physician, my new physician there, and explained what was going on. And she said, okay, well, let's check you out. And she did. She goes, okay, yeah, you're just experiencing stress incontinence because those muscles there are weak. And she said, you need to do some Kegel exercises. And I said, I've been doing Kegel exercises. I'm now, in my mid 30s, and Kegel exercises haven't done anything for me. And she's like, well, we do have a procedure that is out now. Plastic surgeons are doing it, and insurance doesn't pay for it. It's elective, and you go to a plastic surgeon, and it's called Thermava. You can look it up online. I think it's still available. And I think different plastic surgeons call it different. The one that I had looked into, Dr. Lahiri in the Woodlands, Texas, she does one in her spa called Thermava. The problem with that is it's expensive and it's not covered by insurance. And here I am in my 30s with 3 kids now. I can't afford to go have plastic surgery. And it's not a guarantee that it's going to do anything.
So
It's
is
meant
that
to.
is that a tightening or is it like a laser? What do they do to you?
It's an RF heat procedure. They go in with a probe in your vaginal area, and they use RF heat to stimulate collagen production, basically. And it's to tighten the vagina after being stretched out from giving childbirth. Or some women have labial issues where maybe their labials are weakened or hanging down, and it's supposed to rejuvenate all of that and make you, I guess, somewhat younger down there or tighter. But it's no guarantee. It's expensive. I think it was going to cost anywhere between $2,000 to $3,000 for 3 treatments, and then you have to go back for maintenance treatments every year. And it was just going to be an expense that I couldn't afford to do at that time, and especially without a guarantee, because it does apparently do a good job at rejuvenating those tissues as far as tightening things up, but it doesn't necessarily mean it's going to help you with the incontinence problem. So I didn't want to take that chance with that kind of money and not have a guarantee.
That also seems like a pretty big jump to go from Kegels to, okay, now we're going to get some type of invasive procedure done.
Exactly. It's not really invasive. It's outpatient. It's done in a spa.
Okay.
And it's just a probe, kind of like when you go for a vaginal ultrasound. It's the same kind of probe, but it does the RF heating. And it's not painful, at least of the research that I did for it. It wasn't painful. I didn't want the expense. I just thought it was unnecessary. There had to have been something better out there for me. So I continued with my Kegel exercises and in hopes that things would get better, but they didn't. They got worse. Now, instead of just running and jumping, now when I cough or sneeze, I leak. Get ready, like I was saying earlier, I'd get ready to go out to dinner with my husband dressed in a dress, and I'd sneeze or cough on my way out, and man, I'd have to turn around and go back in and change clothes. Now I'm like, okay, I've got to wear a pad all the time. So now I'm starting to wear pads all the time, which after having a hysterectomy, I didn't want to go back to wearing pads anymore. So we moved here to Florida, and I again sought out a new gynecologist, told her of my issues. This time I went to a woman gynecologist. I felt like she would understand women's issues a little bit more. And I made sure she was a little bit more of age so that she knew the the issues that us women go through at these ages. And here I am now, in my 50s, and been suffering with this for a very long time. I told her all about it, and she started offering different options. And I can go into all of those different options with you now if you'd like.
Yeah, sure. Let's hear the different options, then we'll get into what actually ended up working for you.
Okay. She offered to send me to a urologist who could do a mesh sling, and basically it's mesh material that they go in, and it's a surgical procedure, and I do believe the insurance would have paid for it, I believe, or at least portions of it. The mesh sling apparently attaches to each side of your pelvic floor, but what it does is it slings or supports your urethra. So they put it up underneath your urethra, tack it in, and it helps hold your urethra up. And it's a surgical procedure. I seriously considered that because I was at wit's end now, and I was very frustrated. But
Yeah, that was a long
when I
time
started
dealing with something.
Yeah. But when I researched all of the side effects or possibilities or contraindications, when I did all the research, my due diligence on it before I went into it, there were some issues that could crop up that I wasn't willing to take. There were some risks that I weren't willing to take. One was the mesh could erode into the vaginal wall over time and cause painful intercourse. I didn't want to even go into that, because then you have to go into more extensive surgery to fix that and repair it, and then there's no guarantee that you'll recover from that very well. So I didn't want to take that risk.
That sounds like a big risk.
Yeah, and the other one was possible allergy reactions, and I had already had allergic reactions to pellets for hormone replacement therapy, and I didn't want to put anything foreign down there due to the risk of possible allergic reaction, because then again, more extensive surgery and no possibility of having a good recovery. So I didn't want to do that either. So I didn't want to do that. So I asked her again for some more options. She said, well, we could do some injections. They're called bulking injections. I believe Botox may have been one of the options. There's another one. I can't remember all of the names of them, but there's like 2 or 3 out there that they can inject, and they inject it around your urethra, and it's to bulk up that tissue area. And I'm like, okay, well, and it's done kind of outpatient. It's not a surgical procedure, basically. It's, or I guess it can be. I think I did read that it could be. Yeah, it's still very scary. So I looked into it, and because I'm ready to do something, and the risks involved in that were going to be if they did too much, or I had an allergic reaction, or my body just for some reason reacted to it in more than what I wanted or needed. It could cause constriction around the urethra, and then you have problems even going at all. And I mean, I read several stories where women were having those issues, where the injections caused too much bulking, and now they're having issues with being able to go at all.
Then do they have to get a catheter or something like that?
Yes, or reconstructive surgery to go in and fix it. It's just, again, risks that I wasn't ready to take.
No, I agree with you on that.
I can wear a pad for the rest of my life if I have to, you know.
But you'd rather not.
I didn't want to, but I didn't. Yeah, exactly. So I said, no, I'm not willing to do that either. And she says, well, there's another option. It's physical therapy. It's pelvic floor physical therapy. And I said, okay, well, tell me about that. And I've never really been one to think physical therapy was worth its weight in gold. I kick myself in the butt for that now, and I apologize to all the physical therapy guys out there, because it actually did work. It's pelvic floor therapy, and you go to a physical therapist that specializes in pelvic floor, and she did wonders. I was embarrassed to go. It was hard to go the first time. but I did. I was ready to try something again. It was something that I could do myself at home after I learned the techniques. It's something that wasn't going to harm me. If anything, it was going to make things better. When you strengthen your muscles, that's a good thing. And it wasn't some kind of device that was going to be inserted. No stimulation of RF heat, no surgical procedure. It was just simply exercises. And I'm like, well, I can try that. I will try that. So I did go.
And when you first walked in, were you nervous about going in? How did your therapist make you feel? Did she put you at ease?
I was nervous because this is a stranger now that I've got to talk to about something very private. But she was fantastic. She was a doctorate in physiotherapy for pelvic floor. You can have a physical therapist, a PT, or you can have a DPT. And the difference is one has a bachelor's degree or master's degree, and the other has a doctorate. And she had her doctorate in it. She is here in St. Pete, but she works in several different facilities. The facility I saw her at was here in St. Pete. It's St. Anthony's Outpatient Rehabilitation Center. And she's, I think, there once or twice a week, and you can schedule with her. I had 6 or 8 sessions with her. I can't remember now how many. This was last year. But I noticed a difference after the second, maybe. Each time I went, she'd say, okay, are things better? How are things? Tell me what's going on. And I start thinking back, and I'm like, you know what? I haven't had an accident. And it took gradual time for me to realize I wasn't having accidents anymore. And it just was a light bulb. I was like, wow, this is working. This is fantastic.
So what was the first appointment like? What's the first thing, what'd she start with to get you going?
We talked about my history and my issues, and she was able to tell me some of the things that were causing the problem. I had chronic constipation. She said that is a big contributor to it. It was a lot of education on the first one. Educating me on why I was having these issues, and then educating me on what we were going to do to fix them. So one of them was the constipation. And then, of course, you drink less caffeine. I was probably drinking 4 or 5 cups of coffee a day, having a soda here or there. And so she said, we got to get control of your constipation. You got to cut your caffeine down some. And then she started learning about me and my routines. In my job, my career, I scrub in during sterile procedures, like surgical procedures. And with that, I'd be in a 4-hour procedure easy, sometimes 6, and never go to the bathroom. So I had trained myself to hold my urine in for hours. And she said, that's not healthy. If you feel like you got to go, you got to go. So you need to take a break and go when you can. And so we worked with how to do that with my job. She's very good at educating you on how to change your routine to fit what needs to be done. So we talked about that. So the constipation, the caffeine, the holding in the urine, and then the other thing with my career that we discovered in conversation was that I rush. I rush to go to the bathroom. I rush to eat my lunch. I rush to do everything. And I don't take the time to just relax. And so she said, we're going to practice doing that, because the most important thing for you to do is to relax on the toilet. You're not to push, you're not to strain, you're not to rush it. You're to just sit there and let your body do what it's naturally supposed to do. And so the first appointment was a lot of education and teaching me what I was doing wrong or what was causing the issue, and then what we were going to do to fix it. And then that gained my trust, because now what she was saying was making a lot of sense. She showed me a model of the pelvic floor. There's 14 muscles in there. And she's like,
That's
all
crazy.
of these muscles. I know, it's crazy. I didn't even realize it. I mean, I know there's muscles down there, but I didn't realize there was 14 of them within 5 layers of structure, and they work in conjunction with your diaphragm. And she taught me about deep abdominal muscles, and they all work together to regulate the pressure within your pelvic floor, because that's important. You've got to be able to control that pressure. And your pelvic floor muscles, she was showing me, it's like a hammock. And if you're abusing that hammock and putting strain on it and increasing pressure on it, of course you're going to have issues with leakage.
Yeah, you were telling me when we talked about this up front that not only like the muscles you do on Kegels were important, but you said there were muscles like internal to your abs that you were having to even use, to help when you're, make sure your bladder's emptied all the way, and muscles you never even thought were applicable to this.
Right. That's correct. One of the sessions, she had me laying on my back, and you put your fingers on your abdomen, like this, but you're laying on your back, and your feet are propped up, your knees are bent. And she's like, okay, I want you to close your eyes and just relax. And she said, and then I want you to imagine in your abdomen, there's these elevator doors, and they're opening and then they're closing when you're breathing in and breathing out. And she said, I want you to concentrate on that and visualize it in your head. She said, I know it sounds funny, but just bear with me. And I was like, okay, I'm thinking she's a quack, but I was doing what she told me to do. And I was laying there, and she goes, okay, I want you to imagine closing those elevator doors and holding them closed and contracting them closed and holding them there. And so I did. And she's like, okay, let's relax again. And she had her hand on my abdomen as well. And you're doing these fully clothed. You're not undressed. You're not in a hospital gown. You're fully clothed in your street clothes.
And you said private room also.
Private room. Yep. You're one-on-one, and very private, very secure environment. And anyway, she's like, okay, let's try it again. And I did. And she goes, okay, there you go. You got it. And I couldn't really tell from like just laying there that I was contracting those muscles. But she, with guidance, was telling me that there were some deep abdominal muscles down in there that we don't use like for crunches and stuff like that, that you really need to concentrate on and work on. And she helped me with that. And a lot of it was visualization.
Talk about also, you were telling me about the clock positions. That was pretty interesting when you were telling me that it wasn't just the doors closing and opening. There were other directions you had to think about too.
Yes, that's further down. So the abdominal muscles are deep inside, and your pelvic floor muscles, the way that they are all entwined with each other. She had me exercising and imagining squeezing side to side first, over and over again, the side muscles. And then I didn't know it at the time, but then she said, okay, now I want you to squeeze front to back. And I'm like, front to back? And she's like, yeah, front to back. Don't squeeze side to side, squeeze front to back. And so I laid there and I concentrated. I'm like, oh, wow, you can squeeze front to back. And so we practiced that for a while. And once I got the side to side and the front to back done, or worked out in my head and my bottom, she said, okay, now we're going to go around the clock. She said, I want you to go side to side, then front to back, side to side, front to back. And we did those and counted and did repetitions of the exercise. And that's how you're supposed to be working Kegel exercises. Before, when I was in my 20s, and he said, do Kegels at the red light, squeeze your bottom, I was just, if you think about it, when I think back on it, I was probably just squeezing my butt cheeks together, honestly. I mean, or your legs or your thighs, you just tighten down there and you think you're doing a Kegel, and you're not really.
In the research that I was reading just to prepare for this, they said that's the number one thing. Nobody's really doing their Kegels right, so it's not really making any difference at all. So was this all on your first appointment where she's telling you all this, or did it take some time to work up to where you could do the clocks and around the world?
Right. No, the first one was basically a lot of education. We sat and talked about what my needs were, what was going on, and all of that. Then I came back again, and then that's when we started working on breathing exercises, and probably that may have been when she started teaching me the side to side. But the breathing exercises with the abdominal was definitely part of the first exercises, I believe, because she had to
And
get me breathing right.
did you get everything right away? Like at that appointment, did you catch on, or did it take practice before you finally had it down? Or is it something people are going to have to work at, or they're just going to like get it first try?
No. So that's why you go for several sessions, and my insurance paid for it. It's physical therapy,
That's
and my
awesome.
insurance paid for it. I did have to pay a copay, but it was covered under insurance as physical therapy. No, I would say that each session I went to, my ability to understand and perform the exercises properly got better. She would send me home with exercises to do, and she used an app called, I believe it was MedBridge Go.
Okay.
And on MedBridge Go was an app where she could put my exercises in there, give me some notes to follow if I was misunderstanding, and then if I remember correctly, I think I was able. I'm trying to remember if I communicated back to her in that app or not. I can't remember, but probably not, because the way she would post the exercises in the app, it was exactly what we went over during the session, one-on-one. And then, of course, the added notes of if I didn't understand something, she explained it out into the notes of the exercise program in the app. So at home, if I got confused, I could go into the app and go, and she even put videos on how to do it. So it was a good tool to use at home. Yeah. And so then I'd go in the next week.
You said that whole process overall was 6 to 8 weeks. How long? What was the total time?
I think so. I was supposed to go back again for a follow-up evaluation, but I did not. We started into some issues with my husband's health, and so I wound up putting that last visit off because actually in my mind I was cured. And
Right.
I mean, it was just going to be a validation appointment so that she could put in her chart that everything was going great. So I wound up canceling the last appointment and not going. I feel bad about it. I should have went just for the finality of it, or the closure of it, but I didn't. And of course she said, if I ever have any issues, I can always come back again.
Maybe she'll see this and know that's my patient and everything's great.
Oh yeah, I'm actually gonna let her know that we did this so that maybe she'll look you up. But let me clarify on that. When I said that was going to be the last appointment to, I guess, validate everything or to assess how my progress had gone, in the middle, somewhere maybe the third visit, maybe the fourth, she asked me, because I told her, I hope I'm doing these exercises correctly. I feel like I'm doing them right. I feel like I've got it now, what you're saying with the closing side to side, front to back. It's just at one point, it never felt like the front muscle was giving me as much sensation as all of the other muscles. I felt like something wasn't quite right. So with that said, she said, well, with your permission, I can palpate that, meaning put her fingers inside there and let you do those exercises, and I can tell you if you're doing them correctly or not. And I said, okay, let's do it, because I wanted to make sure that I was doing it right. So at that time, she gave me a hospital gown. I took my bottoms off. She inserted her fingers and had me do the squeezes there with her evaluating it. And she said, yes, you're doing them correctly, but yes, I can tell that front muscle's a little bit weaker. It's not squeezing as much. So we're going to work on that. And then that was the only time that I had any invasive, or I don't know what the word is. I'm very glad I did that.
And no other tools, no other devices were used. It was just you, your body, and her and your breathing techniques.
There was one tool used.
Okay.
An exercise ball. This exercise ball became my friend. I almost wanted to put a face on it and call it Wilson because, you use it in some of the exercises. Some of the exercises she had me do, I would lay on my back. I would put the exercise ball between my knees and lift it up and squeeze the ball as I was doing my exercises. And because you're not only going to exercise and strengthen the muscles in the pelvic floor, and you're not only going to strengthen the muscles in your abdominal cavity, but you're also working on your inner thigh muscles and your hip muscles, because all of that works together. For instance, one of the exercises is you lay on your side, you have your knees bent, and you lift the top leg up and you rotate it like this. And you're exercising those, I don't know the names of the muscles, but you're strengthening all of that around your pelvic area in conjunction. And so this helps with some of that. You're squeezing this as well as you're concentrating on breathing exercises. So that's the importance of going to the physical therapist herself, because she's going to make sure that you're doing all of the things in conjunction with what needs to be done correctly. You're not going to be doing it blindly.
I never would have thought of those other muscles having anything to do with it. You know, maybe the core, but definitely not the hips, the legs, inner thighs. That never would have occurred to me.
Yeah.
So what about any type of, you said there was some breathing and techniques. Was it more like a breath work? And did you do any kind of meditation or any other kind of emotional training?
She never encouraged me to meditate, but I had to incorporate that a little bit when I would go to the bathroom, because like I told you, I had the habit of rushing everything. And to sit on the toilet and relax and let my body do what it had to do was very difficult for me. So I would sit on the toilet and I'd close my eyes and I'd go, okay, she told me to just relax. And so I would sit there and I would just relax. And before I knew it, I was urinating. And she told me it's very important. You don't push it out. You don't strain to make it go. Your body has its own functions for that purpose, meaning peristalsis. Your bladder contracts to empty it when it's full. Your colon has peristalsis that contracts and pushes your stool out. Those things are naturally inherent in your body. And when you start forcing those things and rushing them, it can cause these issues. So you have to train yourself to just relax. She told me, sit on the toilet and just imagine that hole being open. That's all you need to do, is just open that hole. It sounds funny, but when you visualize these things, it does help. It does sound funny. And we wind up laughing about it in the appointment. She's not serious and hard to, socialize with. She's very personable. She learned about my family. I learned about hers, but we did a lot of laughing and enjoying each other's company, as well as learning and teaching. But so I'd sit on the toilet and relax, and I just imagine, okay, it's open. And then before you know it, I'm urinating. I'm like, wow. And then the urge to push it is there, and you've got to just breathe. You got to start. I had to meditate and breathe to relax so that I wasn't pushing it.
You just let your body do the work. You've got to focus then not to push and not to help. It's better just to let your body do it all.
Exactly, because you are training, as she told me, you are training your muscles when to work and when not to work. You want them to work when you're sneezing, jogging, running, jumping, whatever, orgasming. You want those muscles to work during that time. So you train it to work during strenuous stuff, like the exercises. When you're contracting your muscles and squeezing, you're exhaling. When you're relaxing, you're inhaling. So on the toilet, when you're trying to relax, you're breathing nice and normal, and you're letting your muscles relax because you want it to relax and let everything go. It's interesting. It really is. I thought it was quack medicine, but once I started doing it just to see if it would work, I surprised myself. Now, I don't leak. I haven't had an accident in a year. Well, since
That's incredible. That's
she
great.
cured me. I mean, yeah. So the
How long
pads have
did it
been
take
long
you?
gone. They were,
I
I want
mean,
to say,
until you noticed a change, not until it was complete, but until you really started thinking, yeah, this is actually something that's going to
trusting it.
work for me. Yeah.
Yeah, when I started trusting it. um, oh gosh, how long? Um,
Yeah, this was a while ago for you too, so it's probably
well, no, I mean, it took a while to trust it because I was still wearing pads even though I didn't need them. I was still, us girls when we are walking and we feel a sneeze coming on, we stop, cross our legs, and hold it, hoping we don't, leak. And I did that for a while afterwards until I realized I'm not leaking. I'm okay. And so, and even then, I had to gradually trust the things that I normally wanted to do that I couldn't do anymore. For instance, okay, I finally learned I could trust a sneeze or a cough, but can I do a jumping jack? You
can
know,
you?
um,
Can you
I
do
can. I can.
it?
Yes, I can. Yeah, it takes a while to learn or get that trust back in your body when you've lost it for so many years. So,
What about outside of the pelvic floor and urinary incontinence? Did you notice any other benefits? Did it help your body in any other way?
I did. One of the things that I was noticing, or I didn't realize until after it was over. My husband and I live on our boat, and we like to take our smaller boat, which is called a dinghy, out on little trips. And if there was any wave action at all, it would make my lower back hurt. I was having a hard time keeping my core engaged. And by the time we get back, I'd be sore and tired and cranky because I just was exhausted from trying to hold myself in this boat. Um, I started realizing after doing these exercises and after I strengthened those pelvic floor muscles, as well as my deep abdominal muscles, as well as my thigh muscles, that I wasn't hurting after riding in the dinghy. We'd go for a ride and I'd be like, fine. And my husband would be like, hey, are you okay? Do you need me to slow down? I'm like, no, I'm fine. Let's go. So there was a silver lining in that. It helped me a lot with my core strength. Absolutely.
That's great. How about the speed bumps in East Limbo Harris on the golf carts?
Oh yeah.
Those are always fun.
That was nice. Well, that's the thing, I mean, traveling, I don't have to take that security blanket with me anymore with called the pads. Um,
Right. I mean, those can get expensive. They can get itchy. You talked about allergic reactions, so you're prone to that. And then also they can show through your clothes. So there's so many reasons you don't want to do that.
exactly, exactly. So it's been a miracle cure for me. Of course, I would think that my physical therapist would tell you it's not a miracle. Her name is Srnkw, and she's a DPT, so doctorate in physical therapy or physiotherapy for specializing in pelvic floor.
Great. So all my people watching in Central Florida, she's over in St. Pete. So check her out. What would you say to the women out there, men and women, because men suffer from this too. What would you say to them today if they're suffering and afraid to go to their doctor or haven't done anything so far?
You did bring up a good point. It is men also, because this sort of thing also helps with stool incontinence.
Okay.
You know, if you've had cancer treatment, it can cause damage to all of those muscles. I highly recommend this. At least try it. For anybody who is experiencing stress incontinence or stool incontinence, please seek this out because it's not invasive. All it can do is help improve your health, your overall health, your core strength, your everything. And it's easy to do. Yes, it's embarrassing to talk to somebody about it, but we all have problems and issues. And it breaks my heart that somebody would not go and seek help just because they're embarrassed to talk about it. Because you can do this in private, one-on-one, and if you're not comfortable, you don't have to go back. So at least try it. At least try it once.
I mean, it's such a shame that nobody recommended this to you sooner. You went through this for so many years. It would have been so great if you had gotten the word years before.
Exactly. Exactly. I'm just thankful that I have it now. And that's why I'm really thankful to you for allowing this information to get out there any way you can get it out there, because I want women, even men, to know that it's something that can be helped. I mean, it may not help everybody, but at least try it. At
Well, it's
least
not
try
going to
it
hurt.
before you go for the surgeries. Yeah.
And it's gonna help your muscles in other ways too, and help protect your back and do a lot of other good things too. I found another resource out there. So if you are looking for a rehab specialist, pelvicrehab.com. Again, I'll put that down in the show notes. And something else, I'm a veteran from the Air Force, and I was reading some emails. All of this is such a coincidence because, like I told you, when you told me about this idea, the next day at the gym, two ladies came up and said, but the instructor and the other person I was working out with, both that they had to run to the bathroom because they had issues with stress incontinence. And then I got an email from the VA, and one of the things I clicked on was resources available to women vets, and they actually offer pelvic floor physical therapy for female vets. So I thought, well, this is great. So I wanted to throw that out there for all my vets listening too.
Right. That link you talked about, I actually saw Emily's name in that link. The link you sent me for the resource that you found, I typed her name in there and she's in there. There's another website that I would recommend. It's the ACOG, so it's the American College of Obstetricians and Gynecologists.
Okay.
They have a wealth of information on there. You can do searches for different information. They have articles on there for stress incontinence. So that's another good resource to go to for information.
Okay, thank you. We'll add that too. Well, we need to do this again. We've talked about so many topics when we've been together. And something else that Kat does is she makes her own flour out of wheat berries, and her husband's diabetic, so they really have to watch his sugar. So that was just such an interesting story. So we're gonna have an episode on that too. And
awesome.
If you've been interested in what we've talked about, if you think it could help somebody that you know, we'd love it if you would share this video with your friends, your sisters, family members, moms, and please like and subscribe. Let me know that you're interested in this type of material. Kat, if somebody wants to know some more about you, can they find you anywhere else online?
I do have a blog. It's not anything to do with health. It's just for fun for me and my husband. When we go sailing, we do a blog. It's SV for sailing. I'm sorry, SY for sailing yacht. Barefoot shoes, BAREFOOTSHOES. So sailing yacht, SY barefootshoes.com. And it's just my blog. I post on there when we go sailing, what we're doing and what we're up to. It's fun, but you can reach out to me there if you have any more questions about the stress incontinence. I am not a subject matter professional, or I'm not a doctor in this at all. I'm just a woman that was having issues for years with frustrations over it and finally found something that worked for me. And I'm willing to share that information with anybody who's interested. But please know, I am not a doctor in it. I'm not a specialist, but I can share with you my experience for sure.
Thank you. I'm glad you brought that up. I meant to say that earlier and I didn't. Well, thank you all for listening. No, okay. Stay strong, sharp, and ageless, and we will see you next time.